Hi, folks. Welcome to Smart Living. I am excited because, I'm always about showing you ways to save money. And how about saving money when it comes to your labs, right? Oh my gosh, sometimes you get labs done that cost $300 to $500. Well, I am thrilled to introduce you to Christine Sewell, who is the director of Hep C Alliance, who is also in partnership with PALS, which is an organization that's going to get us some reduced lab reports. So Christine, first of all, welcome so much. And I appreciate you taking the time to share with us how we can save some money. So first of all, tell me about your organization, Hep C Alliance, and how you're related to PALS, which is going to get us those reduced labs.
Sure. Thank you for having me, Daphne. And it's wonderful to see you again today. So Hep C Alliance, we are an organization that has been around since 2002. What we do is here locally in Missouri, which is where we're based, we offer free testing for hepatitis C through local public health departments. So anytime you go to a county health department, you're probably going to get tested for Hep C through us here in Missouri anyway. We offer that so that when we identify positives, we can then help them get linked to care and do our part to eradicate hepatitis C, not only in Missouri, but just in our nation.
Can I ask you a quick question, just because depending on our audience? Can you educate our audience? I know we're going to talk about these reduced labs, so don't worry, hang tight, guys. I just want to give you some background. But Hep C, educate us. What is that? And why is that so hard to get funding for? And why do you have to use other means to get funding?
Yeah, good
Break
question.
It down.
And I don't think that I've ever had anyone ask me that question before, so I appreciate that you did, because it is a very complex system sometimes. So hepatitis C is a blood-borne virus, meaning that you can only contract it from blood-to-blood contact. The thing that makes Hep C very, very scary is that it can live outside the body for up to 3 weeks on surfaces. So it's very different from HIV. Once it hits air, it doesn't kill it within 24 to 48 hours. Hep C is up to 3 weeks. The other thing that makes Hep C scary is that you can have it for decades and be asymptomatic. So you may not know that you've contracted it, which makes kind of pinpointing how and where you contracted it very difficult. So we do test a lot of, say, first responders and healthcare workers who may have had a needle poke while they were on a call, or were working with someone in the hospital setting and accidentally were poked. We've had children that have found needles, unfortunately, on playgrounds we've tested. And so it's not just a intravenous drug user's virus. It can be contracted in many other ways. There are people who've lived together in the same household for 30 years and one is positive, the other person has never contracted it. But in order for situations like that to work, we have to educate people on the ways transmission does occur and how to stay safe, which is another part of what we do in the education portion with our nursing staff at LPHAs and our patients.
So what I hear you basically saying is that hepatitis C has a little bit of a social stigmatism because it's a blood disease, which therefore people correlate with HIV, or known as AIDS. So therefore they're like, oh, we don't know if we want to fund this. But by the way, this is not a disease that's for drug use only. Anybody can get this through blood transfusions, through needles, young kids can, and it's something that we need to prevent.
So before 2013, we finally had what we call DAA. So they're direct acting antiviral. So those are the drugs that we use to treat Hep C now. So we didn't have a cure for Hep C before 2013. It wasn't until the late 80s where people even knew what Hep C existed. So if you were getting, say, a blood transfusion before 1989, if you had an organ transplant, any sort of transfusion, if you got a tattoo or had your ears pierced, any of those things could have led to a contraction of hepatitis C. And funny that you asked me that. We do a lot of health fairs and a lot of employee health fairs. So, of course, testing for hepatitis C is a request we get from employers sometimes. I've noticed people kind of walk around our table like they might contract Hep C if they come, close to our table, but they don't want to test it because either there's a misunderstanding between Hep A, B, and C, and there's even a D and an E. They'll think, okay, I've been inoculated for that, but what they're thinking about is Hep B. There is no inoculation for Hep C. So when we explain to them that, well, you weren't inoculated for it because no such thing. But I'll ask the women, do you get pedicures and manicures? And they said, well, of course I do. Well, you can contract Hep C if you are visiting a manicure, a manicurist that doesn't clean their utensils the way that they should. If they working on someone and cut their finger and they were bleeding, they had Hep C. Since we know it now stays alive outside the body for up to 3 weeks, they use the same utensils on you. You get caught, you're bleeding. You can contract Hep C that way.
Can Hep C kill you?
It can. It is the leading cause of liver cancer and liver transplants in the United States.
Wow. Okay. So thank you for giving me that background. I know that's not totally on topic, but I think it's understandable for people to understand why this funding is necessary. And so part of that, you have to be very creative in funding. And so you found this way called PALS, which gives us as consumers reduced labs and helps give you a little bit of funding for the Hep C Alliance.
Yes. So I have been with Hep C Alliance since December of 2015. And one of the things that I was tasked with doing was to write grants, of course, to our funding sources. At the time when I started, we had about 5 different funding sources. So we're talking about the Johnson & Johnson's, the Gilead's, Merck, Bristol Squibb, all of those organizations. Well, when pangenotypics came out, meaning that they treat genotypes 1 through 6, the competition went this way. Because now we don't have to have a drug that treats genotype 1, 1A, 1B, or 2, or 3. Now we have a couple drugs that treat primarily all of the genotypes we see in the United States. So what that did was that shrunk our funding sources in the competition. So now we only have, maybe 3 funding sources. That kind of makes you panic a little bit when you drop down in funding sources. So one of the things that I wanted to do was look at how I could diversify our funding. We couldn't rely on grants forever. At some point in time, that entire well will probably dry up. So PALS was an idea that was already set in motion when I started with the company, but I just couldn't understand why we weren't marketing it. So as the source of revenue stream and to diversify our funding and to help other people at the same time that it's totally unrelated to Hep C. We offer discount rates for any lab that is offered by any of the major lab companies. We have 2,000 some locations we can send folks to. But if you're uninsured or underinsured, sometimes, you need labs in order to receive medication. And if you don't have access to insurance and you can't pay $300 or $400 out of pocket, you're just kind of stuck. So organizations such as ours offer our discounted rates, which we already receive because of our work with Hep C. And we pass those on. We pass them on to people that need it.
Got it. Okay. So you guys are getting a discount and then you're like, but wait, can we just offer this to everybody else? But you just have to go through us in order to get it. We have a little bit of that money we're going to make and we're going to take that for ourselves and we're going to help our cause, which is also helping greater good of society. Bravo. In preventing Hep C. So I get that. So tell me a little bit, because this is what we want to know. We want to know how you're going to save me money on my labs. Yes. So what do I need to do? Now, I'm going to try and do something I've never done before because I've got the website pulled up and I thought maybe you might be able to walk us through. And if you can't, we'll do it verbally because this is a podcast that we do have videos. So I'm going to see if I can share this tab right here and see if that comes up on the screen. And are you seeing that on your screen?
I do see that. And if we get this to work, this would be wonderful because oftentimes, people get frustrated in this field trying to navigate the healthcare system because it is complex and convoluted. Our system is so user-friendly. Most of the time, I have to explain it because people are making it harder than what it really is. So this will be great.
Okay, so it's called pals-labs.org. So this is where you will go when you need to get labs done, no matter where you live in the country, in the US, right?
Right.
Okay, so walk me through this. So I'm on the main page. You're seeing what I'm seeing. Where do I go?
So go to the top and you'll see a tab that says tests and prices. If you wanted to go through and learn about PALS and who we are, and which I just explained, you're more than welcome to read about that. But tests and prices, We're going to find the links for our pricing list. And I do have those in Excel on our website because it makes it super easy. They are in alphabetical order, but if you just use that find function, if you're familiar with Excel, it'll jump right to what you're looking for.
So when I go to, hang on real quick. So I'm at the tab and I pull up test and price. I'm going to scroll down on that page. And then I see these look like links. So it says printable test code, with your price list. Is this what this is
So
for
that's what I
pals?
was, yes. So the downloadable test code, the Excel or the principal test code and price list sheet, that is very useful for any providers who may be listening and want to use our program for their uninsured patients. You can find all the
Okay.
labs that we offer on that list. So that would be the link you would use for that. When you're ready
Okay.
to order, you're going to want to click the link that says click here for online ordering.
Okay, so you can look up the prices, so when you get an order from your doctor, you just tell your doctor, just give me the order, then I'll come home, I'll come here to the website, and then I can look up. So they usually have these are general test codes for pretty much anything. So for example, if I wanted a COVID test, just for example, I would just type in the code 16, or look up 164055. It'll say that on my lab
Yes.
report, and that's going to
Yes.
cost me $55, right?
Right. So they are in alphabetical order, and using that find function makes it easy for any office staff, because we do work with providers that we train to create their own requisitions, so they will need to know those codes. Whereas
Okay.
if I'm working directly with the patient, then I'm putting the codes in.
Got it.
So that's
So
why,
your lab, just for clarification, so my lab order that I'll get from the doctor will have codes that will correlate with those codes.
not always.
Okay.
That's why I'm here. So
Got
again,
it.
I've been doing this for more than, close to 10 years, I guess. Not more than, but close to. So, I do have to translate lab codes a lot, because sometimes people will go to a doctor, that doctor prefers to use a different lab or maybe a local smaller lab. So then I have to
Okay.
figure out which codes correlate to the list that we have.
So how can I, as a consumer, look that up? Do I contact you directly?
Oh yeah, you would just call me. What you
Okay.
can do,
Okay.
so what you can do is, if there is something called a CPT code. Now the CPT codes are universal no matter what lab you're using.
Okay.
The issue with the CPT codes is sometimes if it's a panel, it'll have several codes. But the easiest thing is just to call me. That's what I'm here for. So if you go
Okay.
through our program, we will take care of all of that. We will translate any different lab codes for you. We will help you figure out which test you're needing, if they're called different things, because different labs call the same test different things. But the coolest thing about it is that you won't get those pesky after the fact lab bills that we all get in mail.
Okay. Okay. Well, this is just another way. I mean, there's a little bit of dancing around that you have to do. So either reach out to you or go through those forms, the CPTs and all of that you explained. I'll have Christine's email on my blog article.
Yeah, so
Just
really, I mean, if you get down to just the ABCDs of it, if you would come here, you click on the link that says click here for online ordering. So if you do that, you'll
okay.
see your form, and it's very simple.
Trying to bring that up, but it's not letting me. It brought this
Well,
in. Hang on.
I'll describe it in the meantime, and if we can't get it up, then we'll have a description of it anyway. But it's just your general patient demographics. Oh, there it is. So just the
Can you
general
see it good? Okay.
name, birth date, the things that we would need to know. Once you have all that filled out, the next section would be your lab test. So you can really scroll back up just a little bit. Yep, right here in this box. So this is where you're going to put those lab codes we were just discussing. If you don't have, I tell people all the time, just put the test names. That is totally fine. I'm used to figuring out codes, so that's no problem for me.
Okay.
So you would put your test codes or the test names in that section, and then your physician's information, the fax number, because those lab results do get sent directly from the lab to your provider. So you're not having to call and look for it. Your provider's not having to call and look for them. They do get sent directly from the lab upon completion.
Okay, as long as you provide the proper information there where it says physician information. Now, as far as payment, if I'm not sure what my test is going to be, how do I know how to pay it?
Sure. So we're just asking on this form in what way you'd like to pay for your lab. So we do have a lot of people, yes, that are older, and maybe I work with a lot of folks that do not use email, or they're not really sure how to use their email. So for those folks, we do accept checks and money orders, and they'll just mail it in with our printable order form.
Got it.
Yes. So the
And then
invoice,
after we submit this, then you'll reach out and then tell us what lab to go to?
yes. So the invoice to be emailed, that's generally how we do it most of the time. We will send you an itemized invoice that lists the individual test costs and the total. If that all looks fine to the patient, then they would pay it directly from that invoice. That then allows us to create the lab requisition, send that to the patient with the address to the lab.
Okay. That sounds good. Okay, I stopped sharing the screen, by the way.
No, you're right. Yeah. So it sounds
Okay.
complex, but the entire process can take as little as 10 minutes.
Okay. So for each lab, not each lab, but every time you order labs, because it can be many, there's an additional $15 processing fee added on to that.
Yes, and that is, again, you're right, per order, not per test.
Right. So you want to make sure you have a lot.
Yes, and that helps us mitigate the cost of what we're charged for the lab draw, because we do get charged for the venipuncture too. So that offsets that.
Okay. So can you give me an example of some of the prices, like really popular ones? I will say for myself, the one I get done every couple of months is my panels for my hormones. Do you guys do that? And how much, can you give me an idea of what that costs? Because sometimes I've paid, oh gosh, as little as like $50 and sometimes as much as $250.
Sure. And then again, you run the risk of a secondary test being, if it's a reflex test, so say your doctor orders a test that has a potential reflex. If the initial test is out of range, then it's going to run a secondary test. That's when you get your surprise lab bills in the mail.
Okay.
You think you paid for everything. So that will not happen. If you ever get a bill in the mail, it's because for some reason the staff didn't enter the billing information correct. But we fix that. We take care of all that for you. So if you're a provider, you don't have to deal with the labs or the billing. And if you're a patient, you don't have to either. We do it. But to your question, so like say your doctor wanted to order a thyroid profile. So for us, a thyroid profile is $12. So paying $12, you might pay $50 or $60 for that out of pocket for a cash patient.
Okay. Well, I mean, that is definitely worth it. So that's a great way. So if you have really bad insurance that's not covering your labs, or you don't have any health insurance, you need to get labs done, this is another alternative to go about doing that. I have one more question for you, Christine, that I didn't quite get. So when we fill out that form, how do we know that order came for you guys? Like, how do you get credit for that?
I think I understand what you're asking me. So, credit, you mean, so when you submit it, it comes directly to me?
Yeah. So it just comes directly to you?
Yes.
Okay. Got it. Okay. Because I mean, I know other people use PALS, but that particular portal is directed towards you. That's what
So that particular portal is on our website. So we are PALS. So we have Hep C Alliance and in the PALS program. So that's both sides encompasses both sides of our organization. But yeah, we are PALS. So we
got it.
That. No, and in fact, we just actually acquired, Econo Labs. I don't know if you've ever heard of that one. There are other organizations like us out there. Econo Labs was one of them, and it was owned and operated by a physician who saw the same thing that we did, that there was a need for discounted labs, and started his own organization. We are the only 501c3. Everybody else in this field is for profit. So he actually helped us out and said, you know what, I don't want to sell this, I want to donate it. And so we are helping him with his patients now so he can retire.
Wow, I love that. Yeah. That's total win-win.
Yes, it's a win-win for everyone. That gets him a nice deduction and then gets us, a little bit more business and our name out there a little more. We're small. We're a 501c3. The one thing none of us have is marketing dollars. So
right.
Anything we can do to market, then I have people ask me that all the time. Well, I've never heard of you. Where have you guys been? Like, well, we've been around. We just don't have a lot of extra money to throw around for marketing because we're focusing on patients.
Right. Well, I'm glad that I can help market you.
Yes,
how's that?
I appreciate that.
Well, Christine, absolutely. Listen, thanks again. We're redoing this interview because last time we had a bad technical issue. So I will put this back up on my platforms. And as you guys know, you can read the article, follow up, all that. Just head to my blog at smartshopperdaphne.com, and I'll have all the information for PALS, which, by the way, is pals-labs.org. Am I saying that right?
You got it.
But I'll have it there on my website. And don't forget, guys, I'm Daphne Monroe, your smart shopper.